Well, I'm 3 days into being at home after that 41 days in the hospital, and slowly starting to get things built back up. But it's obvious it's going to take a little bit longer, but that's fine. I'd much rather be in front of the computer doing a few things anyway. And I'm still going on about this ambulance bill. There's a couple of things come to mind. I mean, to me, it's a hidden tax. Yes, Alberta doesn't have any type of provincial sales tax, but we've got lots of hidden ones. The 9/11 system in this province, we pay for that in a lot of ways. I was just going over my phone bill, and everybody in this province with a TELUS landline or anyone with a landline, you're paying 44 cents per month for the municipal 9/11 answer fee and 11 cents for the provincial network answer fee. Well, that may not seem, like a lot, but when you add it all up, and I just took a wild, and I think it's lowball estimate, say there's 2.5 million landlines in Alberta, and I think that's being conservative. That means there's 1.1 million raised for the municipal fee and 275,000 that goes to the province to maintain the 9/11 network. I'm not saying that pays for it all, but there's more money coming in. The 9/11 is a service that's provided to citizens. When you call it, you don't expect when the fire department or police to show up to receive a healthy invoice from them later on. There may be cases where they can do this. I don't know, but I do continue to have a hard time with the ambulance bills being what they are. I don't mind paying a little bit. That's fine. But I know in BC it's $75. That's a long cry from the $351 bill I received. And I'm wondering what is this government doing with our money? We do pay taxes. There are monies transferred back here. There are federal health transfers as well. Why is it 2/3 of the services on the 9/11 are covered, and the other third we wind up paying for? Again, I don't mind paying for some of it, but when you've got programs here that trap people in poverty, little things like this continue to be issues. So when I go then to the organizational chart that I downloaded from Alberta Health Services, just to give you an idea of how much of our money goes to high-cost administration. And I'll just tell you, right now I'm on page 6 of a 49-page document. And that lists the Chief Operating Officer and other executives. So Chris Eagle, of course, right now is our Chief Executive Officer. He took over after Dr. Cookie left. But then he has an Executive Vice President and Chief Operating Officer. And underneath those, there are 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 6, 7 senior vice presidents, which is different from the EVP, as in executive vice presidents. And then there's another 1, 2, 3, 4, 5 vice presidents, which again is different from the senior vice presidents. So that's on page 6 of the org chart. How many levels of vice presidents do we need? One I'm looking at, linen and environment services. Well, my understanding is most of the linen services is contracted out. So I really have no idea what that person is doing. But a lot of our money is going to these positions. And I'm going to be getting around to more of them as I go through. So I'm still questioning, why are we paying $350 for a needed essential service like an ambulance? I have grave concerns over the number of seniors that are sitting at home afraid to call an ambulance and run the risk of dying there because they can't afford, they have to make up their mind that month between medication or food. And that number is high, as the little experiment in Toronto just proved. So if they're afraid to call an ambulance because they can't afford it, you know, this province, that's, to me, that's not the intent of our health care system. I'm going to keep stressing care, because that, to me, is a big difference from health administration. And that's what Alberta Health Services is all about. They're into health administration. They're not into health care. And I pretty well had as much of it as I'm going to take, so I'm going to spend the next little while doing a lot of this kind of stuff. I'll pay their friggin' bill. I mean, you don't really have a lot of choice, do you? But there's, you know, for those people out there, we're paying a lot of money through different venues to a government that keeps talking about fiscal restraint and fiscal management. Something as needed as an ambulance shouldn't keep people from accessing saving their life if need be. Especially when I look at this horrendous list of organizational charts and the amount of money that's going into administrating something that's falling apart. And you'll see that on my next blog when I do a little comparison between McCaig Tower at the foothills and the unit I was on at the foothills. It's like a tale of two cities. And McCaig Tower has a lobby that would make some five-star hotels downtown embarrassed. When you got a 20-foot gas fireplace in your lobby and a grand piano, you know, that's not where I think our tax dollars should be going when it comes to healthcare. So I'll be back. Just one man's opinion. Have a good day.